Nelson?
One question I'd like to ask is, what's your take on the health care crisis in America, and what direction would you like to see it go with this, and what solutions might you have?
Yeah. Well, here again, on health care, just to say that every once in a while I hear someone say something like, well, you know, all the candidates, they kind of agree on these issues. And I want to say, we do not. You know, pay attention. Pay attention to the war spending. Pay attention to climate change. Pay attention to health care. Health care crisis in this country is the one I hear most about going around the state of Minnesota. It doesn't matter where I am, urban area, rural area, small town. People are just absolutely frustrated by health care. And it's bankrupting a lot of families. If you look behind the people that are losing their houses, oftentimes it's a health care emergency. It's people, it's the number one cause of bankruptcy, and most of the people who are declaring bankruptcy because of a health care emergency have health insurance, but it's health insurance that doesn't cover everything. So a lot of people find out that their health insurance isn't nearly as good as they thought it was when they have a crisis. So we need, and what I argue for is we need a national solution to our health care crisis. And Al Franken says, let's turn all 50 states loose and see what they come up with. I say that's a really bad idea. We end up at best with the Minnesota-Mississippi divide, and more likely you're ending up with already financially strapped states that aren't going to be able to put together a system that's going to address the health care needs. So here's what I advocate. I say, first of all, I ask people to think about health care in terms of three different things. The first is universal coverage. And universal coverage, that's a goal. But I say, don't let politicians get away with saying, I'm for universal health care, because all that is a goal. And then the question becomes, how do you get to that goal, right? And so the second thing I say is, I'm for a national single-payer health care system. And the reason I'm for a national single-payer health care system is because that's where you can get a lot of cost savings to make that coverage universal. About 35% of our health care dollar is now eaten up by duplicative bureaucracy. And so if you have a single-payer system similar to what Canada does, an expansion of Medicare, we have two essentially single-payer systems in this country. We've got the VA and we've got Medicare. If we improve both of those and united and then expanded coverage to everyone, I think that is a practical way to go that fits this country. Now, just to clarify for people, because it's very important, people think, oh my goodness, if we have a single-payer healthcare system, then I don't get to choose my doctor. Yes, you do. You get to choose your doctor. You still get to choose your hospital. That doesn't take away that. It's publicly financed healthcare. But then the third question still remains, and this is really a critical one. What kind of quality healthcare system do we want? We could have a crappy single-payer healthcare system, or we can have a really good one. And it will depend upon what we demand. And what I would demand are these things. We want a system that focuses on prevention. We want a system that will reward providers for wellness outcomes, not just for treating diseases. We want a system that has the parity between mental and physical and dental and drug treatment. We want that included. You know, that was Paul Wellstone's dream, right? That still is to be fulfilled. We also want to have other cost control mechanisms, because the real obstacle to a decent healthcare system in this country right now is that politicians let the kind of healthcare system we have be determined by the pharmaceutical industry and the insurance industry. We have to be willing to challenge that power in order to move into this direction. So we need to have cost control mechanisms. So that's what I say about healthcare. Universal coverage, that's our goal. How do we get there? I think the best way to get there is through a single-payer healthcare system. But then we have to address those quality issues and what we want in a healthcare system. The good news is there's so much money wasted in our present system that there's plenty of resources there to actually have a high-quality system that will have coverage for everyone. But we're going to have to redirect those resources. We now spend twice as much per capita on healthcare as any other industrial country, and they have universal coverage. They have much better outcomes in terms of longevity, prevention, a whole series of indicators. So that's one we can do something about right away. The other candidates in the race, they say that the people aren't ready for this. And my response is, the people are way ahead of the politicians on this. So we need to unite to push that agenda forward. It's another thing that a movement can help achieve. But I will tell you, the recent survey in Minnesota showed that 65% of physicians in Minnesota want a single-payer healthcare system. So it's not like you've got 5% of physicians saying, I want single payer, and 95 that are against. You have a significant majority, 65%, that actually want to move to that system. And I think they look at doctors in other places. They look at doctors in a truly socialized system, which is Great Britain, are making lots of money. I mean, they do very, very well. So I think that that's an issue that we can certainly deal with. And again, one could make the case that if we're not squandering so much of our healthcare dollar on duplicative services and bureaucracy and equipment that not all hospitals need to have, then you can fairly distribute that dollar in ways that might actually enhance. One other piece that I add to this that I think might be important. I understand that this is what we're asking, if we're going to move to a single-payer healthcare system, is we're asking a group of people who are employed in that sector to not stand in the way. Because right now they're standing in the way because their personal livelihoods are at stake in some cases, right? So I would advocate that we take part of that healthcare dollar savings and we put it into retraining. Now, some of those people are going to be needed in this system anyway, but some of them are going to be displaced. And we're asking a group to do something that the country desperately needs to happen. We should help cushion that blow. In the same way, we need to do that with the military-industrial complex. One of the reasons we have so many unneeded weapon systems being produced is because there's a constituency that's working there and they're afraid they're going to lose their jobs. So we need peace conversion. We need to convert those plants, or we need to retrain the workers. I would say the same thing about the healthcare system, because maybe that can take away some of that resistance.